Welcome to this training on the Regional Mass Casualty Incident Communications and Exercise Plan. This is brought to you by a number of agencies, and we're sure you're going to find it helpful. We're going to cover a number of topics in this training, including all the things that go into our MCI communications plan for this region and the drills that we're going to be performing to exercise those plans. So we'll talk about the planning process itself. We'll talk about salt triage and the salt triage materials, the regional hospital notification system, regional mass casualty incident radios and radio talk groups, the Greater Dayton Area Hospital or GDAHA Surgenet MCI page, OHTrac, and our drill plan. The objectives for this training include all of the following. By the end of this, you should be familiar with our regional MCI communications plan and the job aid that goes along with it. You should obviously be familiar with salt triage already, but we'll include a review of salt triage and the materials that are involved. You should understand how to use the regional hospital notification system, and again, the RHNS is included in your standing orders. You should be able to locate and use the HSR3 MCI Marks radio talk group that's in your radio template if your agency is on the Marks radio system. You should be familiar with the GDAHA Surgenet MCI page, and you should understand the relationship of all of these different tools, the RHNS, the Surgenet MCI page, the OHTrac system, and the MCI Marks radio talk group, bringing all this together to improve communications during an MCI. And finally, you should be familiar with the MCI Communications Quarterly Triage Drill Day Plan. And those drills are going to start very soon and involve every agency virtually in the region. We've had many groups come together to develop these plans and work on all this, including fire, EMS, law enforcement, emergency management agencies, hospitals, public health, Dayton MMRS, GDAHA, Greater Miami Valley EMS Council, and many others. All of these came together and recognized that there was a need to bring all the pieces of communications together into one process and one training program. These groups developed the RHNS, or Regional Hospital Notification System, and developed plans for use of the GDAHA Surgenet MCI webpage. They added the MCI talk groups to radio templates for EMS radios and hospitals throughout most of our region, certainly for the counties that are utilizing the Marks system, and we'll talk more about that. And the hospitals, through Greater Dayton Area Hospital Association, agreed to purchase MCI radios for each emergency department to make all this work. And finally, these groups developed job aids. This is the job aid that the group developed. It tells you exactly what the process is and how to make communications work best in the middle of the chaos of an MCI or a disaster. And we'll be talking about the sections of this job aid. The plan for the quarterly triage drills was agreed on by the GDAHA Domestic Preparedness Coalition, Greater Miami Valley EMS Council, Miami Valley Fire EMS Alliance, Greater Montgomery County Fire Chiefs Association, and others. The drills will happen one day each quarter for a 24-hour period from 8 in the morning until 8 the next morning, and the day of the week will be different during each quarter so that all emergency department and all EMS personnel have opportunities to participate in these exercises. The day will be selected each quarter by the GDAHA Communications Committee and then communicated to all the hospitals and EMS agencies, and we'll give you lots more information on this later in this presentation. So we're going to start with a quick overview or refresher on SALT triage and some of the tools that we use. SALT divides triage categories into 5. Immediate is what we tag as red. Those are the patients who have immediately life-threatening conditions. Delayed is yellow. These are patients who have serious problems but who can wait for at least a time. Minimal are the green patients. Those are the ones who have only minor injuries or minor problems. Gray is expectant. These are patients who have significant injuries to the point where they are not expected to survive given the resources that are available at that time. And expectant patients certainly can change and be upgraded as needed. And finally, dead, that's traditionally been triaged to black. We have changed that slightly in our region. We use a zebra striped ribbon and a zebra stripe on the tag to make this more visible during low light conditions. So let's go through very quickly the SALT triage process. And it begins with the global sort process. We ask patients who can walk to a designated area, and those who can't walk to wave or make some kind of purposeful movement. The patients then who are still or who have an obvious life threat are the ones that we go to and assess first. The ones who can't walk but who made some movement are the ones we assess second, and then last are the ones who walk. But obviously all of them need to be assessed, and there are times when it's appropriate to skip the global sorting step. An example of that might be a rescue task force in certain active shooter situations. Or another example would be at a hospital. As you're having patients come in one at a time, you probably don't need a global sort step. The next step in the process is the individual assessment, and part of that individual assessment in SALT is using what we call the LSIs, or life-saving interventions. That is, controlling any major hemorrhage, opening the airway, and if it's a child, you can consider 2 rescue breaths. That is the only difference for pediatrics in SALT triage. You can perform a chest decompression if there's evidence of a tension pneumothorax, or if the scenario involves organophosphates or nerve agents, you can utilize auto-injector antidotes. From there, we begin the actual assessment by checking to see if the patient is breathing. And a patient who's not breathing, or a child who's not breathing after the 2 rescue breaths, in a mass casualty incident is triaged to dead and receives a zebra-striped ribbon. If the patient's breathing, we then go to what SALT refers to as the 4 key questions. Is the patient able to obey commands or make purposeful movements? Does the patient have a peripheral pulse? Is the patient not in respiratory distress? And is major hemorrhage controlled? Now, these questions are all designed so that they come out with a serious condition leading you to one answer and a not serious condition leading you to another, but we'll show you an easier way to memorize this in just a moment. But after we've looked at the 4 key questions for each patient, we then move on. If all of those are answered as yes, and the patient has only minor injuries, then they're triaged to green or minimal. A patient who has some significant injuries but still has a yes answer to all of the 4 key questions, that patient gets a yellow ribbon and is delayed. Finally, any no answer, any one no answer to any of the key questions, we then have one last question to ask, and that is the patient likely to survive given the current resources at hand? So most of these patients who have a no answer to the key questions are probably going to be at least potentially survivable, and so they become immediate or red-tagged patients. The patients who are not likely to survive but who are viable at this time become expectant and are tagged gray, and we can provide palliative care. So there are a couple of mnemonics that we use to help people with SALT triage, and really the only hard part of SALT triage is memorizing the 4 key questions and making use of them. So our mnemonic for the 4 key questions is CRAP. C, is the patient able to follow commands? R, is there respiratory distress or no respiratory distress? A, is arterial bleeding. Is there uncontrolled arterial bleeding or no uncontrolled arterial bleeding? And finally, our P, is our peripheral pulses present? And then our second mnemonic is forget about the yes and no and exactly how these questions are crafted, and simply think of them this way. Is the answer to the key questions good or bad? A patient who's unable to follow commands, obviously that's bad, and an answer to any one of the key questions means that patient immediately goes to either red or gray, depending on whether they're likely to survive given the resources available at the time. We have provided for each of the hospitals a SALT triage system, kind of cliff notes, what the receiving facility really needs to know about SALT. And a copy of that is provided attached to this training program. That SALT triage for hospitals provides you with the process, provides you with the categories, and also shows you the live triage tag, the white tag that is used in an actual mass casualty situation. It also shows a picture of our triage ribbon kits, and each hospital has been issued one of those triage ribbon kits with all of the ribbons that apply to the SALT system. That brings us to the Regional Hospital Notification System, or RHNS. The Regional Hospital Notification System in our region provides one number that EMS, hospitals, emergency management agencies, and others can call and get a rapid, simultaneous notification for all the hospitals in the area whenever there's an MCI or other major emergency. We can use it whenever an incident's likely to involve a significant number of the region's hospitals. It does not have to be all of the hospitals. If a number of hospitals need to be notified all at once, you can use the RHNS. We can also use it, as you'll see, to indicate that there's not an immediate need for action. In any of these cases, the Montgomery County Regional Dispatch Center puts out a computerized message to all the hospitals. And we're not the only place in the country that has a system like this. After the San Bernardino active shooter attack on the Inland Medical Center, a paramedic who was still en route to the scene activated their equivalent of an RHNS, saying we're not even there yet, but we think you need to know this sounds bad and you should start getting ready. And unquestionably, that early notification saved lives, and our hospitals encourage EMS to do the same thing. We can use the Regional Hospital Notification System for any incident that's likely to involve or concern 6 or more hospitals, and that's a general statement. The number may be smaller or larger for your scenario. If you need to notify a whole number of the hospitals, think about using RHNS. Our message can be one to ask hospitals to gear up, such as we have a crash with 36 seriously injured victims that are being extricated. It can be a situation where we've activated a ChemPack for our region. It could be to tell the hospitals that all of the patients from this incident will need decontamination. Emergency management agencies, or EMAs, in the region could use it when we have a scenario that involves multiple jurisdictions, such as a tornado that's gone through several cities. We can also use it to tell the hospitals that their disaster preparations are not needed, and we've done that after things like the Middletown school shooting, a cyanide spill in Dayton, a local hospital shooting, and other situations, none of which required our hospitals to go into disaster mode. And we've provided a job aid or a checklist that dispatch centers throughout the region can use to activate the regional hospital notification system. The primary purpose is simply to let the hospitals know what's going on and let them know what preparations are needed and what preparations are not needed. Hospitals should not call the dispatch center after receiving an RHNS message to request additional information. We have a better way for hospitals to do that, and that's the MCI radio that we'll be telling you more about. However, a hospital or the incident commander can put out a later message to provide an update or to send a message simply saying that the incident is being closed out. Each hospital receives these notifications, and the numbers that are called by RHNS for each hospital were chosen by that hospital. We did make the recommendation that in any emergency messaging system, any call to a cell phone should get both a text and a voice message, so that if one system is overwhelmed during the incident, it's likely to get the message through on the other system. Receiving RHNS messages is easy. You simply answer the phone or read the text. It alerts all of our hospitals, plus it alerts some of our regional coordinators, some of our EMAs, and others. And the system is tested every month and then tested additionally during most of the major exercises that are conducted in our area. To activate the regional hospital notification system, simply use the communications job aid that's attached to this training and that we mentioned earlier. You call the number 937-333-USAR. USAR are the letters standing for 8727. So call 333-8727 and ask for the dispatch supervisor, telling the supervisor you're requesting a regional hospital notification message. You'll see that the job aid leads you through the process of exactly what the dispatch center is going to be expecting from you. You'll be providing the name of your agency, the nature of the emergency, and the location of the emergency, as well as some statement on the severity of the situation, an approximate number of victims, and any other information that you think needs to be included. The job aid will also ask you to include a statement on use of OHTrac, Surgenet, and MCI radios, as you'll see as we go on in this training. So that brings us to the MCI radios that we've mentioned multiple times in this. And the MCI radios work on the Ohio Marks system, MARCS stands for Multi-Agency Radio Communication System. It is a statewide system of systems. So, for example, the Montgomery County radio system became part of MARCS and became one of many radio communication systems that together make up a statewide system. You'll hear us often use the term talk group in this training, and basically talk group means the channel that we're using for this radio. With the MCI MARCS radios, we have an additional talk group that's on the radio template, and each hospital has agreed to buy a radio to be used solely for the MCIs. Typically, the way this will be labeled is the channel will show HSR3 MCI as the radio talk group that you would be using. And HSR stands for Homeland Security Region because we are in Homeland Security Region 3. We can use this talk group to notify each hospital of the patients that they'll be receiving. But we also use this so that all of the hospitals get a common operating picture simultaneously. Regardless of what the incident is, we can tell everyone at once exactly what it is that's going on, but at the same time, hospitals can ask questions for clarification over the HSR3 radio talk group, and then all of the other hospitals hear that answer at the same time. The MCI radio is different from the radio that EMS uses to call the hospitals on a day-to-day basis. Because this is a party line, it goes to all the hospitals at once. There is no alert tone on the MCI radio. You'll get the notification to turn on and monitor the radio by way of the regional hospital notification system. Then during an event, you monitor the MCI radio throughout that event, and that request to monitor it is included in the communications job aid. But anytime you receive a notification about an MCI in the area, you should plan to monitor your MCI radio. During a mass casualty incident, for the most part, expect that about 90%, maybe even more, of EMS communications will come from the transport officer or the transport officer communications aide at the scene. Hospital radios may have a couple of primary radio talk groups for MCIs. One of them is the HSR3 MCI talk group, and the other is the HSR6. Region 3 is the area that includes Montgomery, Greene, Preble, Clark, Darke, Shelby, Miami, and Champaign counties. HSR 6, Homeland Security Region 6, is the Cincinnati region that includes the counties of Warren and Butler as well. And we do have the capability for an incident that would involve both regions to patch these together at certain dispatch centers. Now let's talk about the GDAHA Surgenet MCI webpage and OHTrac. This is the GDAHA Surgenet MCI webpage. It's on the same website as the rerouting webpage, and you can see that each hospital is listed along with their receiving capacity and the number of patients they've received. So we can indicate by triage categories how many a given hospital has received in this incident and how many more they're capable of taking care of, as well as certain specialty capabilities like OB, pediatrics, and decontamination. Most of you already have access to the GDAHA Surgenet MCI page. As I said, it's on the same page as the reroute page. If you simply scroll down below the reroute information, you'll see the MCI page. If you don't have access to either page, you can request access by simply going to gdaha.surgenet.org and clicking on the Request Access button. For those of you who already have access to the reroute page, if for any reason you can't see the MCI page down at the bottom, simply go to the same website, gdaha.surgenet.org, and click on the Contact Us button. Let them know, and GDAHA will see that that's fixed so that you can access both the reroute page and the MCI page. The GDAHA Surgenet MCI page is really important because we have increasingly emphasized during MCI training to EMS personnel, and included this in our standing orders, the importance of not overwhelming a single hospital or even 2 or 3 hospitals during a mass casualty incident. To get the best care for the greatest number of patients, we need to distribute those patients to multiple hospitals. And the Surgenet MCI page allows hospitals to indicate how many you've gotten by category and how many more you can truly effectively handle. So we will ask you immediately during an MCI to update your Surgenet MCI page and keep updating it every 15 or 20 minutes. To help with this process, the state of Ohio, the Ohio Department of Health, and the Ohio Hospital Association worked together to create OHTrac, which is a web-based tool for tracking patients during any mass casualty incident or disaster situation, and it provides for family reunification so that we can bring people together after the disaster. MCI incident alerts are included as a feature of OHTrac, but it is important that you remember these are not a primary method of communication, and so our primary methods of communication during MCIs are the RHNS and the MCI radio talk groups. I would also like to remind you that OHTrac, like all aspects of this, can be used not only in real-world incidents, but anytime you're conducting an exercise. Hospitals are responsible for ensuring that patients who are received from an MCI are entered and the tracking information updated, including your walk-in patients. All of this needs to be updated in OHTrac. Using the Surgenet webpage and OHTrac can allow EMS and dispatch centers to figure out exactly what the scenario looks like around the region, not just at the scene, but how are the hospitals doing? How many have they received? How many by each category? And it is possible for EMS and dispatch centers at their option to log on and view the numbers of patients by triage at each hospital. We're integrating all of these communication methods to help EMS ensure that the right patient goes to the right hospital during an MCI. And by the way, there's an app for that. The OHTrac app is available for download free of charge. It's available on both the iPhone system or iOS and the Android system. The app was designed for EMS, and an agency using it can actually start patient tracking using OHTrac at the scene of an incident. You simply use the built-in scanner that comes with the app to scan the barcode from the triage tag. And by the way, hospitals can use the app too if they choose to. Using OHTrac helps us to have truly accurate methods of tracking the patient from the field all the way through the hospital, provides for that family reunification, and allows hospitals and other agencies to see the number of patients, the acuity of the patients, and where those patients wound up. So again, here's our MCI Communications Job Aid, and this is designed to help you put it all together. We recommend that EMS agencies include a copy of this in the transport officer clipboard that's been provided for EMS apparatus around the region. We recommend that hospitals keep a copy of the job aid close to the radios. We want this to be available to everybody on both sides. The intent is very simple. We want EMS and hospital personnel to be able to talk to each other effectively during an MCI. So let's run through a scenario. There's a county fair going on and the stage collapses. It's summertime. There was already one EMS unit on standby at the site. Dispatch starts receiving calls that there are 50 people who are injured, some of them severe. Dispatch, either acting on its own or at the request of the EMS unit that was on site, immediately puts out a regional hospital notification system. They learned from what San Bernardino did, that putting out that message very early can have a big impact on the success of dealing with this incident. So hospitals receive an MCI message that says there's been an MCI reported as a result of a stage collapse at the county fair with initial estimates of 50 people injured. Every hospital should update your Gadaha Surgenet MCI page, and all hospitals please monitor Homeland Security Region 3, HSR 3, MCI Marks Talk Group. Each hospital receives that RHNS message and immediately turns on their HSR 3 MCI radio. They quickly update their MCI page to indicate the number of red, yellow, and green patients you're able to receive and effectively manage. And obviously you start preparing to receive casualties. Part of that means you're going to make notifications within your facility, so remember that that's communications too, and you need to know exactly who you're going to call and what the process is to make those notifications. Finally, prepare for use of OHTrac, and if you're one of the facilities that's close to the scene, you should look and see if there's an OHTrac incident, and if not, create one. Continuing the scenario, the EMS unit on scene has recognized that this is a major incident and has requested a full response and multiple EMS units. They have approximately 50 victims, as we said before, and their initial triage shows that they have 26 red patients, 14 categorized as yellow, 10 who are green, and 2 who have been triaged to black. So when does this all end? The incident commander or someone designated by the incident commander can use regional hospital notification system again to indicate that all or most of the patients have now been transported. The hospital receives the second notification that the incident is essentially over. All of the patients have been received by the hospitals. Well, now that you understand the process, let's talk about how we're going to practice it, because we're going to use this system, and we're going to start using this system every quarter so that we're all able to use it effectively when the big one happens. Once a day, one day each quarter, every patient in every emergency department in the region is going to be getting a triage ribbon and a triage tag. We're asking EMS to do this on all their patients, but if not applied by EMS, the emergency department personnel will be applying these. And every EMS and every emergency department is receiving a supply of these green triage drill tags. During the quarterly triage drills, we're going to use the green drill tags. Please do not use the white tags that are on the left side of your screen, those are the tags that we would use in a real MCI, and they're more expensive because they have some additional features. We're going to be using the green drill tags, and they say for drill only on them, and the whole tag is a light green color. We will use the actual triage category of the victims. So use your triage ribbons, use the real triage ribbons, use the appropriate colored ribbon for the condition of the patient, and then mark the tag with the appropriate color on that tag. But again, using the green drill tags, not the white actual incident tags. Remember that our triage tags don't have ties or rubber bands. We use the triage ribbon to attach the tag. So the first step is to select the proper color ribbon. Then later on a tag is attached. If the patient's condition changes and we need to attach a new ribbon, then we take off the old ribbon but continue to use the same triage tag. Each tag has a barcode, and that's true on both the white tags and on our green drill tags. So the barcode is there, and there's a matching human readable number. That patient's barcode can be scanned into the OHTrac system. All patients arriving by EMS should have a triage ribbon and a green triage drill tag applied. Emergency department personnel put on a ribbon and tag on any patient who arrives, whether they're a walk-in to the emergency department or whether EMS simply got too busy and was unable to attach one. During quarterly triage day drills, we ask that EMS place and fill out a green triage drill tag on every patient. So you're actually going to complete the tag. You'll use the ribbon color that's appropriate to the patient's triage category, and you'll mark the triage tag to indicate that patient's category as well as information about that patient. You'll use actual patient information on the triage tags. Do this as if it were actually an MCI, but do this on every single patient. And of course, then the thing that's different about this from an MCI is that you'll continue to fill out your run report as you would every day on every patient. Each EMS already had blue triage ribbon kits for use during actual MCIs. You're going to use the actual triage ribbons for these quarterly triage day drills. If any agency is running short on ribbons, although there's a lot of ribbon in those kits, if you start to run short, contact Dayton MMRS. We do have a limited supply of additional ribbons. Finally, each EMS agency is receiving a supply of the green triage drill tags for every one of your ambulances, and you're getting those through your county emergency management agencies. We've already delivered them to every county. If your EMA hasn't already contacted you, give them a call. They've got those drill tags ready for you to pick up. Please remember, the white tags are for real incidents. Use the green tags for the quarterly triage day drills. Here's the modified MCI communications job aid. So we've struck out the things that don't apply and highlighted in yellow the things that do apply. Now, you don't have to try to memorize this in the short time it's going to be on screen. A copy of this is also attached that you can download and print out attached to this training. As we incorporate this, these will be very brief reports, like a 1 or 2 word description of the medical issue and the patient's color category. Wayne Hospital, this is Greenville Medic 591 en route with 1 yellow. If EMS needs to communicate more extensive information or needs orders or other requests, they'll call as they normally would. And recognize that depending on workload, any of this may go out the window on drill days. We recognize there are times when you've got to focus on the job at hand. So attached to this training are some handout materials to help you. We gave you a copy of the SALT Hospital handout. It's just a 2-page sheet, so if you want a very quick review of SALT, you might want to use that, or you can go to the standing orders. The other thing we gave you is 2 versions of the MCI Communications Job Aid, the real-world version that we hope every EMS agency has put into every transport clipboard, so you have it available. And then we gave you the exercise version for the first quarterly triage drill. Remember that there will be new versions of that as we build in other steps in the process for future drills, and we'll send out through the EMS Council listserv those new versions of the drill job aid. Finally, we've got the examples of these job aids. Remember, the one that's all clear and is on the left is the real world job aid. The one on your right is the one highlighting just the things that you'll need to do on our very first quarterly triage drill day. We'll put out a new one for future drill days so that you can use it as a checklist as we add things into our building block training approach. Finally, we'd like to thank Greater Miami Valley EMS Council for providing the continuing education for this program. It is EMS continuing education that's usable both by EMS personnel and by nurses. Simply take the accompanying quiz and you'll receive an immediate continuing education certificate. Thank you very much for taking the time to watch this presentation and for being part of each quarterly triage day. Thanks again.